There are several micronutrients that have now been studied to help with reproductive health and infertility, and namely we're going to chat about certain antioxidants. Certain micronutrients have been studied to be beneficial for fertility treatments, specifically because of their antioxidant activity, and this is a very crucial mechanism that we need to support reproductive health for a variety of patients. Antioxidants have now been implicated in supporting things like egg quality, sperm health, and namely, oxidative stress as environmental stress can negatively affect egg quality and ovarian health. So we've seen oxidative stress has now been implicated in affecting things like follicle maturation. It may affect some of the granulosa cells in the ovary, could affect corpus luteum, and we see that it can also affect the DNA integrity of the follicles themselves. So reducing oxidative stress, especially with age, because as we age, oxidative stress seems to increase, becomes very crucial for patients that are going for assisted reproductive technologies like IVF, or even if you're trying to conceive naturally and looking to boost egg quality. When we're looking at natural health products for the treatment of egg quality and supporting fertility rates, it is very important to help understand where the scientific evidence is with respect to each of those ingredients. And there's one product that's gaining quite a bit of popularity recently. It's called NAD+. And I have a lot of people that have asked me over the last few months about using NAD+. They've been reading about it online. And I want to share more information about NAD+ and where our stance is right now. So NAD+, to begin with, is actually a very important coenzyme. It's used for several metabolic processes in the body. It's used as a cofactor to help facilitate some of those enzymatic processes. So it has a very well-established role in our well-being, and on a physiological level, it seems to have an important role in supporting antioxidant activity as well. However, there are several supplements that have now been promoted as if you use this NAD+ boosting supplement, it's been shown to help with fertility. And what I do want to clarify and want to help highlight is that the studies where they've been using them for fertility are still limited to animal studies. So rodent studies have shown some research that it may be beneficial for fertility when we use some of these NAD+ boosting supplements. And therefore, the research is still in its infancy and very limited. So it may not actually be advisable to spend hundreds of dollars per month on a supplement that hasn't actually been used, rigorously tested in randomized clinical trials with actual human studies. So this is something that's, we're not quite there yet with the research when we compared to other antioxidants and micronutrients that do have randomized clinical trials for the treatment of infertility and subcategories of infertility diagnoses such as PCOS, endometriosis, advanced maternal age, or low egg quality. So certain micronutrients seem to have more research when it comes to helping with infertility than others. NAD+ is one of the ones that we're still very early in that research curve. So maybe down the road we have better studies about it, but at this time, because there's only rodent studies, it's not something that I'm personally recommending for our patients at the clinic, at least. But the role of NAD+ has been studied for several other health conditions, and using these NAD+ boosting supplements is not the only way to support NAD+ activity. In fact, there are several pathways by which we can increase NAD+ activity from a physiological level. In fact, actually just consuming the amino acid tryptophan is a very important mechanism by which tryptophan is used in the liver, and it produces a significant amount of circulating nicotinamide, so that vitamin B3 for the rest of the cells to use, which then can increase NAD+ activity. So actually just getting a healthy protein amino acid, tryptophan, and having tryptophan included in a healthy, balanced diet is already helping to increase the production and activity of these important cofactors. Another pathway to help improve NAD+ activity is actually just supplementing with vitamin B3, which is actually present in most prenatals and multivitamins already. So if you are trying to conceive, likelihood is that your doctor has already put you on a prenatal, and it probably has a decent amount of vitamin B3 to begin with. The recommended daily allowance, or RDA, is around 15 to 16 milligrams for biological females of reproductive age, although certain supplements will go much higher than that. So that's like the bare minimum that you should be trying to get from your diet supplement total if you are trying to conceive, and for general well-being as well. Two other healthy ways of supporting NAD plus activity is actually related to lifestyle. So regulating the circadian rhythm, such as making sure you're getting a good night's sleep, restful sleep, and engaging in physical activity have actually been implicated in supporting NAD plus activity as well. So it's not just about diet, it's also about your lifestyle. A third easy way to help supplement NAD plus activity in the body or production is actually related to our diet. So specifically, supplementing with nicotinamide riboside, which is actually found in our diet, has actually been shown to improve NAD plus activity as well. So this isn't something you need to actually go out and get a supplement for. It's already found in several fruits and vegetables, in certain grains and dairy products there as well. So check with your healthcare provider about how much vitamin B3 you're getting, number one, through your multivitamin or prenatal that you've been taking, and number two, what type of a diet and lifestyle activity you should be considering adjusting to or making changes to or keeping as is to help make sure you're supporting that NAD plus activity, which we understand has an important role, but this is not the same as purchasing supplements that are promoted as NAD plus boosting products, because we still have limited research on whether those products actually translate to improved outcomes or not for patients dealing with infertility. But making sure you have a healthy and balanced diet, engaging in regular physical activity under the guidance of your healthcare provider, making sure you have a good lifestyle, making sure sleep quality is good and restful. These are all things that translate to other health benefits as well and may actually help support the NAD plus activity as well.